So basically, which you already probably know, we kind of have the costal cartilage here, right there. I mean, obviously this diagram shows all the ribs, but the cartilages are like right there, right? You definitely have like a little bit of an indent, discomfort like on that right side when you kind of lay in. So, for whatever reason, whether it's knee on belly or the compression that you had to it or whatever happened when you popped it, there is some disruption that occurs with the cartilage. Now that cartilage can be almost like it kind of like pulling across. It doesn't always necessarily pull, quote, off the bone like a piece of meat or something like that. But when you have like that initial phases of pain, which is like kind of you're in the 1 week or less type of stage, I said to you at the beginning, is this more likely a more severe injury than the average person, or is it the fact that it's still kind of newer? I don't know. And I say I don't know because, like, if it's newer, you're gonna have more pain than somebody who has it like 3 weeks out, right? So it seems like it could be one or both, right? So I'm not gonna make claims on like is it worse than someone else's. I'm just gonna give you the guidelines and stuff like that. I tested you on some of the musculature. I'm not gonna. Here's the external oblique. We know that when you use your external obliques on the right, you have some increased pain, both sides. And then we know when you do the internal obliques on the right, you have some increase on pain. But if you look at both of them, I'm just gonna get rid of the. Here's the external on this side, the internal on this side. You can kind of see that they all attach to the ribs anyway, right? They kind of like.
Yeah. That thing is awesome.
Yeah, it's pretty cool. I mean, you can see that, they do attach to the ribs. So any type of abdominal movement or pull on it, when you kind of even do like a guard, just like a guard retention, stuff like that. I did test some of the hip flexors. One, jiu-jitsu guys really typically need a lot of hip flexor work. Second of all, we do have some fascial pulling because like the hip flexors do attach in this region, right? And if that region is pulling down from or having some tension build from the contraction, also they attach to the spine. But when we have that, we can have some pulling of the abdominals. We can also have engagement of the abdominals, and then obviously in your case you had some irritation on that. When you bring your arms up and do stuff for rotation, we're really kind of stretching out the ribs, increasing the spaces. But you have a good fashion of movement, which is great, but you just have a lot of inflammatory pain associated with that. So in terms of healing time, in terms of capacity, these are all things to talk about that we will have conversations on. But I'm not a big fan of adjustments of the ribs. A lot of people say just put it back in place. That's not how it works. And if I can do that gentle overpressure and you have pain, it's gonna hurt if I kind of really hit you and jump on you. So there's no reason, and it's not like it's like people don't realize that other than the floating ribs, where your pain is, it's actually at the rib cage. If we like look at the rib cage, and I think a lot of people don't remember this, it's a cage, right? So imagine like any cage. There's a back to it, and there's a front to it, but like the reason people think that they slide out of place is because now the cartilage is kind of like fascially healing. There's all this disruption. It's almost like if you broke something in the house or something like that, it's not going to be completely intact, right? And so it didn't completely separate and come off the bone. It's not like I'm going to just go there and put it back in place. But what we're trying to do is really realign the kind of the fibers and help the cartilage heal. In my career, I'm not a big fan of adjusting ribs, especially jiu-jitsu ribs, because they're usually more of a strain. They're more of a strained cartilage than they are a misplace of it. I typically adjust the back of the ribs because they tend to help provide a lot of relief to the front. Because they do wrap around. Right.
Because that pop was like scary. Like
you felt the pop in the front.
I even asked the guy I was rolling with. I'm like, hey, did you feel that pop? He didn't feel it, but I definitely did. It was like a rubbery pop, like I said earlier. And it wasn't feel like didn't feel like a snap.
Yeah,
So-
I think you had a good strain of the cartilage
Okay.
that goes over the bone and stuff like that.
Mhm.
And you could feel the disruption. I mean, even if you laid on your back and kind of just like closed your eyes and like
Mhm.
felt like that. Even
I was
in
doing
this
that
position-
last night, and I couldn't tell the difference. Maybe because I'm using two different hands here, but maybe
you could feel that the right one has a little bit of an indent
Okay.
on the right, and I don't know if that's just naturally how you were but I can just only correlate it. You know, there's a little indentation. There's definitely some disruption. It's a new injury.
Mhm.
So, what we'll go ahead and do is we're gonna treat some of your hips. We're gonna go ahead and treat some of the abdominals and of course the rib cage itself,
Okay.
and probably a lot of the fascia and connective tissue in the muscles on the back side that wrap around as well into that.
Okay.